Have you ever noticed how your heart seems to pound harder in those first few minutes after waking up and wondered why that happens? The first 30 seconds after you open your eyes might actually be one of the most important moments for your blood pressure. You see, overnight your body naturally loses water through breathing and sweating, and that changes how your blood flows. By morning, your blood can become thicker and more concentrated, which means your heart have to work a little harder. Now here's what most people don't realize. The simple habits you choose in your first hour awake can make all the difference. Research shows that the morning hours between 6 and 10 a.m. are when blood pressure tends to be at its highest. But there's good news. Small changes to your morning routine can help ease that pressure in a surprisingly gentle way. Let me walk you through 4 morning habits that experts say can help seniors maintain healthier blood pressure throughout the day. The very first habit starts before your feet even touch the floor, and it's the simplest one of all. Before you stand up, try gently pointing and flexing your feet 10 times while you're still lying in bed. This little movement helps get your blood moving back towards your heart before you put any weight on your legs. It's a small thing, but experts say it can help prevent that dizzy feeling when you first stand up. The second habit has to do with what you drink, and the timing matters more than you might think. Starting your morning with a glass of room temperature water can help gently raise your blood pressure to a safer baseline. Quick note before we go further. This is general health information, not medical advice, so always check with your doctor. Now the third habit, eating a balanced breakfast that includes protein and fiber, rather than skipping it entirely. Research suggests that skipping breakfast can lead to bigger blood pressure swings throughout the morning. A breakfast rich in fruits, vegetables, and whole grains is associated with better blood pressure management. The fourth morning habit is about gentle movement, and it doesn't have to be anything intense or exhausting. A short morning walk or a few minutes of stretching can help calm your nervous system and lower your pressure. And here's the surprising part. Just 10 minutes of walking after breakfast can actually improve how your body responds. Studies show that walking after a meal can help reduce the natural rise in blood pressure that follows eating. But wait, there's another habit that makes a difference, and it involves something you do naturally all day. I'm talking about breathing, but not the shallow kind you do without thinking. Deep, mindful breathing. Research shows that slow, deep breathing can activate your body's relaxation response and gently lower blood pressure. Here's a simple technique. Breathe in through your nose for 4 counts, hold for 4, and exhale for 6. Do this for just 2 minutes in the morning, and your body begins to shift from alert mode to calm mode. Now here's a pattern interrupt for you. Did you know that how you take your first sip of water matters too? Gulping your water too quickly can actually trigger a stress response in your body, so slow and steady wins. Another powerful morning habit involves your posture, something most of us don't think about when we wake up. Sitting up straight helps your lungs expand fully, allowing more oxygen into your body with every breath. And better oxygen flow means your heart doesn't have to work as hard to pump blood through your body. Now let's talk about something you might not expect: the connection between your morning bathroom routine and blood pressure. Draining during a bowel movement can cause a sudden spike in blood pressure, so it's important to be gentle. This is why some doctors recommend elevating your feet on a small stool. It helps with proper body positioning. Another simple morning practice is checking your blood pressure at the same time each day and recording it. Consistency is key. Checking at the same time helps you see real patterns, not random fluctuations. And tracking your readings can give you and your doctor a much clearer picture of what's happening. Remember, small, consistent changes add up over time. Your heart will thank you for these morning habits. In the next section, we'll dive deeper into how these habits work together and what science says about them. Now let's look at the science behind these habits. Starting with why your morning blood pressure naturally rises. Your body releases hormones like cortisol and adrenaline in the morning to help you wake up, but they also raise pressure. Here's the good news. Your morning habits can actually counterbalance that natural rise in a gentle way. Think of it like a seesaw. Stress hormones push blood pressure up, and calming habits gently pull it back down. Now, here's where it gets interesting. These habits don't just work alone. They work together like a team. Hydration helps your blood flow more easily. Breathing calms your nervous system, and movement strengthens your heart. It's not about any single habit being a magic solution. It's about the combination that matters. Let me share what happens inside your blood vessels when you start your morning with these simple practices. When you drink water first thing, you're essentially thinning your blood, making it easier for your heart to pump. And when you eat a protein-rich breakfast, you're stabilizing your blood sugar, which helps steady your pressure. Now, here's a surprising fact. Deep breathing actually triggers the release of a natural blood pressure regulator. That regulator is called nitric oxide, and it's one of your body's most powerful blood vessel relaxers. So when you breathe slowly and deeply, you're literally helping your blood vessels relax and open wider. But here's something most people don't realize. Your morning walk does more than just lower your pressure. Walking improves your circulation, strengthens your heart muscle, and helps clear stress hormones from your system. And when all these habits work together, hydration, food, breathing, movement, your body's systems align beautifully. Now, what about common mistakes? Some people do these habits wrong, and it can actually backfire. For example, drinking too much water too quickly can actually stress your heart, so sip slowly. Another mistake. Starting your day with caffeine before you've hydrated can temporarily raise your pressure. So to recap, water first, then coffee or tea. Your heart will appreciate the order you choose. Now let's talk about something that happens before you even wake up. The quality of your sleep. Poor sleep can actually make your morning blood pressure higher, even if your habits during the day are good. Research shows that getting 7 to 8 hours of quality sleep helps your body regulate pressure naturally. A consistent bedtime routine is just as important as your morning routine. They work hand in hand. Now let's talk about medication. If your doctor has prescribed blood pressure medication, timing matters. Some blood pressure medications work best when taken at night, others in the morning. Your doctor decides. Never change your medication schedule without talking to your healthcare provider. Consistency is key. Never change your medication schedule without talking to your healthcare provider. Consistency is key. Beyond medication and habits, there's another powerful tool. Stress management throughout your morning. Taking just 5 minutes to write down what you're grateful for can actually lower stress hormones. And here's something wonderful. Connecting with loved ones in the morning can also support heart health. Social connection has been shown to reduce blood pressure and improve overall cardiovascular health. So a morning phone call or shared breakfast isn't just nice, it's a health habit worth keeping. Now here's a question many people ask. How long does it take for these habits to make a difference? Some people notice changes within a few weeks. For others, it takes a couple of months. Everyone is different. The key is consistency, not perfection. Doing these habits most days matters more than doing them perfectly. So how do you build these habits into a sustainable morning routine that actually sticks? Start with just one habit you can do consistently, like drinking a glass of water first thing. Once that feels natural, add the second. Maybe a few minutes of stretching before you get out of bed. Then add breakfast and a short walk. Building slowly is how habits become permanent parts of your day. And remember, the best routine is the one that fits your life and feels good to you. Let's go deeper into your body's control center, the autonomic nervous system, and how it affects pressure. The sympathetic system is your fight or flight response. It raises pressure. The parasympathetic system calms it. Your morning habits directly influence which system is more active, and that determines your pressure. Now, here's a fascinating detail. Deep breathing actually stimulates the vagus nerve, your body's calm-down cable. And when the vagus nerve is stimulated, it releases calming signals that slow your heart rate and lower pressure. This is why the breathing technique we discussed earlier is so powerful. It's backed by real physiology. Now, what about drinking water? At the cellular level, hydration helps your blood maintain proper viscosity. When you're dehydrated, your blood becomes thicker, like honey instead of water. Your heart works harder. That's why hydration is so critical in the morning. It helps your blood flow more easily through your vessels. But here's a common barrier: What if you're not a morning person? These habits can still work for you. If you're not a morning person, try keeping a glass of water by your bed so it's the first thing you see. Another barrier, pain or stiffness in the morning. Gentle stretching can actually help ease joint discomfort. Research from the Mayo Clinic suggests that movement, even gentle movement, improves circulation and reduces stiffness. If walking outside isn't possible, try walking indoors. Even 10 laps around your living room counts. Another barrier, you might not have time. But these habits can be done in as little as 10 minutes. From the American Heart Association, consistency in tracking your blood pressure is strongly recommended. The AHA notes that home monitoring can help you and your doctor make more informed treatment decisions. And one more tip, try pairing a new habit with an existing one. It makes the routine easier to remember. Remember, these habits are about supporting your health, not fixing something that's broken. They're tools. Your body has an incredible ability to adapt and heal. And these morning habits support that natural process. Let's bring everything together. A simple, step-by-step morning routine that supports healthy blood pressure. Step 1. Before you even sit up, do 10 gentle foot pumps while you're still lying in bed. Step 2. Sit up slowly and drink a full glass of room temperature water before anything else. Step 3. Take 2 minutes for deep breathing. Inhale 4, hold 4, exhale 6. Step 4. Eat a balanced breakfast with protein, fiber, and fresh fruit or vegetables. Step 5. Take a short walk, even just 10 minutes, to get your blood flowing gently. And if you take medication, step 6. Take it at the same time each day as your doctor directed. That's it. 6 simple steps that take about 15 to 20 minutes total each morning. A gentle reminder, progress matters more than perfection. Some days will be easier than others. Be kind to yourself on the days when things don't go perfectly, and celebrate the small wins. Every glass of water, every breath, every step is a vote for your health. And those votes add up. Your heart works tirelessly for you every single day. And these small habits honor that work. So I invite you, choose one habit to start tomorrow morning. Just one. And build from there. Then add another when you're ready. And watch how your morning transforms over the weeks ahead. Before we go, I want to say this. You're not alone in this journey. So many people are making these changes, and your doctor is your partner in this. Always keep them informed about your habits and readings. As always, check with your doctor before making any significant changes to your health routine. If you found this helpful, please share it with someone you care about. It might help them too. And if you're new here, consider subscribing for more health education content like this. Thank you for spending this time with me today. Here's to your health, one gentle morning at a time.